So first, I'd like to tell my story. In 2010, I was first diagnosed with DCIS, which is Ductal Carcinoma In Situ. Basically, what happened was on a mammogram, they had found some calcifications, like near my nipple, which indicated to them that there was cells that were basically what cancer is, messed up cells. As the cells duplicate, something happens, something goes wrong in that process. So the milk ducts were blocked, which caused these calcifications that just looked like little speckles on my mammo. So it wasn't a fully formed tumor. So this is where early detection is so important. Mine was caught so early and very treatable. So at the time, I had opted for a lumpectomy and radiation as my treatment choice. When they did testing, they found that the cancer itself was estrogen positive, meaning that the cancer cells feed on estrogen. I was tested for genetics, and that came out negative, so that was good. When they tell you that it's hormonal, they tell you it's very treatable. In the process, though, they wanted me to take estrogen blockers once the radiation was done. But I didn't want to do that for a couple of reasons. One, I am one of those people who goes online. I Google, what is it? You know, look it all up. I look at message boards, all those things you're really not supposed to do. But I am one of those who's voracious for information like that. And I was just reading horror stories about, because the estrogen, you know, when they're blocking the estrogen, personality changes and you just become really aggressive and miserable. I'm already that enough. I didn't want to take my personality flaws and take them to 10. So I opted not to do it. Also, I had never had a child, and I was 38, 39. I didn't want to not have that option anymore. Before I started my radiation, I went to see about getting my eggs frozen. And I got all the testing done, and they said they couldn't even find my right ovary. They told me there's nothing going on down there. We couldn't even in our right mind take your money at this point. So it just seemed like everything, all the decks were stacked against me. So they said, come back after radiation, we'll do testing again. So I had the lumpectomy, I had radiation. I opted not to do the tamoxifen, to my oncologist's dismay. She was not happy about it. Oncologists like to work in statistics. Everything is statistics. Okay, so now you have this. You have the lumpectomy, you're down to an 80% chance of it coming back. Okay, now you do the radiation, you're at a 40%. You do the tamoxifen, you're at an 18%. They like to work in numbers. Everything is numbers to them. You know, in my experience, I have found that oncologists are very, you know, very by the book. Everything is statistics with them. So anyway, after I did the radiation and everything like that, I went back and did more testing at a different fertility clinic. And again, all my levels were low, nothing was looking good. However, they wouldn't approve me to do any fertility treatments, because what are fertility treatments? Hormones. They pump you up with hormones. And they said I would have to get permission from my oncologist for them to go ahead and do that. And my oncologist said, you're absolutely crazy. I am not going to let them pump you up with hormones. Your cancer feeds off of hormones. So why would you do that to yourself? At the time, of course, I said, well, don't tell me what I can't do. I'm going to do what I'm going to do. And by the grace of God, my husband and I got pregnant naturally. He'll take a lot of credit for that one. So I took a big chance, and she told me that. You know, at that time where I'm pregnant, I'm so happy, this is wonderful. She was kind of the one that burst my bubble, and she said, all right, she really gave me I don't want to say I told you so, but you're really taking a big chance because your estrogen spikes when you're pregnant, as you know. But I thought I had the baby, everything was fine. I thought everything was fine. Many of you know my little peanut, that's her. Little nugget. So at this point, it was all worth it. 5 years later, most people say it's always that 5-year mark too. If you make it the 5 years, then you're in the clear. Of course, my 5-year checkup, it came back. Same exact thing, little calcifications in that same area. Yes, I can say I should have just had a mastectomy back then. I should have just gotten the whole kit and caboodle and just gotten it all over with. But at that time, it seemed way too radical. You know, you didn't have your Angelina Jolies and your Christina Applegates and Sandra Lee and all these people who are just boom, boom, getting it done. At that time, hearing somebody having a bilateral radical mastectomy was like, oh, so traumatic and so over the top, you know? So to me, it wasn't an option. It just seemed too extreme. For just a little bit of calcifications, we can get them all. We'll do some radiation to try to catch the last little bits. Never thought in a million years it would come back. But unfortunately it did. And now that it came back, I opted, now, you know, I had the kid, I'm married, you know what, do it, get rid of it. It seems to be the hot Hollywood thing to do. Everyone's doing it. Throw some Botox in it. Hey, do everything while you're there. So I did, and here we are today. So in June, I had the mastectomy and had the tissue expanders put in. And the tissue expanders are basically like deflated implants. And then you go, after 2 weeks, some people did it after 4 weeks, you go once a week and they fill you up with saline, basically to your tolerance, to whatever you can take. I started out big. I said, give me 50 cc's, let's go for it. Dealt with the pain, had painkillers. Next week, did another 50. After that, started going downhill. Oh, it's too much. It's too much. It's like medieval torture, just the stretching of your skin. Now, where I got into trouble was my right breast was the one that I had radiation on. And he had warned me that sometimes skin that has been radiated doesn't take well to the stretching. Now me, with my Puerto Rican skin, I've never had a sunburn. I hardly burned from the radiation. I'm like, no. Believe me, my skin can take it. And I didn't think I'd have any problems, but I did. It just wasn't stretching out. So what had happened was it was going inwards. So it was really digging into my ribs. So it got to a point where we said, okay, I can't go any further. You know, what you got, which was fine. You always keep thinking, in the grand scheme of everything, it's fine. I'm not going to have the big gazungas I had planned in the first place. This is where it's going to end, and it's fine. So we said, okay, let's book the surgery to do the exchange surgery where they take the expanders out and put the implants in. A couple of days later, the skin was still all red, was not looking right. So I texted some pictures to my doctor, which is hysterical to me because I'm so against people texting naked pictures to anyone, or God forbid putting them on the internet. And here I am texting pictures to, you know, a man who's not my husband. So he looked at it and said, nope, you got to go to the hospital. It's not right. There's an infection forming. It looked like it was spidering. It was really bizarre. And then the skin actually started getting eaten, like I had a flesh-eating disease, like in a movie. It was horrible and incredibly painful. But luckily, you know, when you go to the hospital, they put that IV in, start with the morphine, and you're good. So between the morphine and IV, that's what I did for that whole weekend. Monday I had the surgery. It turned out to be 8 hours long because he really just cleaned everything out, took all the skin, everything. I mean, he was so thorough about it. And then he had to do what's called a lat flap, where they take part of your latissimus dorsi muscle and they take the muscle and the skin, they bring it to the front, they tunnel it through your armpit and use it to form the breast. And they keep it attached because we want to keep the vascularity of the muscle and of all the tissue. So it's absolutely amazing how they do it. He's an artist. I mean, it's amazing. So after that, you know, I went around with one fake boob and one flat for a month or so. And then in December, I had, he put an implant in the right one. So that's where I am today. You know, I'm a little tight. I'm kind of the full range. I really recommend restorative yoga before and after the surgery, just to really keep yourself really loose. I went today to a place in Asbury Park, called Cure Wellness Spa, and I found a massage therapist who really, I had talked to him before, and he really researched and made sure he knew what he was doing, and he really helped. I can feel the difference. My arm really is up there now today. So he did a lot of myofascial work where he was kind of stretching the skin. It's kind of like stretching the top layer of the skin from the muscle. Sometimes you'll hear that when people do scar massage as well. It wasn't like he was doing like kneading kind of thing. You have to be really careful because he could elicit lymphedema, and I'll get into lymphedema in just a quick second. Okay, so what I do, I have to turn my space heater off, I'm sweating. Okay, what I recommend to people when they are first diagnosed and have already made the decision to do this surgery, the first thing I recommend is assembling your team. And it's funny that my sister's on right now. Many of you know my sister's story. She is going through this as well. She has a very different story and a much more dire situation. But the first thing I had said to her was, you need to get that team together, because you have your doctor, and your doctors, a lot of doctors don't really tell you what's available to you. The first thing I always recommend is getting a nurse navigator. Some places you have to ask for it. I was very lucky at Morristown Memorial the first time around. They gave me my team. This was at the Carol B. Simon Cancer Center in Morristown. They gave me my team. They were like, you're going to have a nurse navigator. You're going to have a social worker. You're going to have a this. You're going to have a that. And they put everything in place for me. And I thank them for teaching me that, because the second time around, I knew what to do. And I went to Riverview. Corinne was my nurse navigator. She's fantastic. And she sat with me and went through all of my lab work with me with a fine-tooth comb, everything. They are your key person. They will hook you up with an oncology social worker. And what's so important about the oncology social worker is not only are they somebody to talk to, they're your therapist, basically. They can refer you to a therapist. So I also have an oncology psychotherapist. Believe me, you want your team. You want everybody there for you. The more the merrier. But the oncology social worker can give you a lot of resources for finances. They will hook you up with all sorts of charities. And I actually, my first oncology social worker, she did all my applications for me. I had times where checks just came in the mail. I was like, oh, okay. I don't know, she did it, and that's great. I think this social worker may have as well, because I got a check from a charity called Just Us Girls. I never applied for anything. I tried to contact them to thank them. They're like, just these ghosts, you have these angels, they just want to give. And one day I had a check. I recommend more local organizations. I'm gonna give a shout out to Breast Intentions. They helped me. The Beauty Foundation. Hi, Carla, I hope you're on. They're gonna have a big gala in April. I'm really excited about. That's how I got to meet Peter Criss. That's a whole other story, how I randomly got to meet the drummer from Kiss in her living room. He's gonna be honored because he actually had breast cancer. A man, it happens. So they're really important. They also can help you with things with human resources at work, your disability paperwork, your FMLA paperwork. That's stuff you want to do immediately. So that's one of your first things you want to get taken care of. And you're in such a state and you're so overwhelmed and so much is going on, let these people help you, because that's their job. And it can be really confusing. Who the heck knows how to fill out disability paperwork? So get your HR people together at work with them, connect everybody, and if you can jump out and not be the middleman anymore, and one less thing for you to worry about. But that's something you want to look into. So a nurse navigator and an oncology social worker. They were really important, okay? You have your breast surgeon and you have your plastic surgeon. Your breast surgeon is someone who's just going to do the mastectomy, and that's probably it. I saw him once, he did his thing, and that was it. My relationship was more with the plastic surgeon, because they're really the one afterwards that are going to handle everything. And my plastic surgeon, Dr. Taylor, he has such a great team of women. His physician assistant, Mary, and his nurses, and they've been a real support system as well. Because, you know, you're talking about boobs and stuff, and sometimes it's a little uncomfortable with the men. You're just constantly, as soon as you walk through the door, you're throwing your shirt off. You're just always like naked in front of everybody. It just gets so ridiculous after a while. So with the girls, it's always kind of good because they know what boobs should look like and feel like and that sort of thing. So a good plastic surgeon is not only good, but check out the plastic surgeon's team. The office, the staff, the front desk person, things like that. Because you will have a lot of appointments because you're going almost every week to get those fills for your expanders. So you're there a lot. You have a major relationship with them. Oncologists, that's a tough one for me because I find a lot of oncologists are just, they can be a little curt. They're like, because they're the scientists. You know, people have ones that they do feel really close to and they can rave, rave about them. So ask around, and if you don't feel comfortable with what their treatment plan suggestions are for you, just go to somebody else. Shop around. You have to know that you can shop around. Don't feel stuck. And I know my sister's probably sitting there going, this is the broken record that I told her. She didn't feel right with one, I think it was her radiation oncologist. She didn't feel comfortable with him, but she's new to the game. She just felt like that was the person she had to have. I was like, no, you don't like this guy. Go to somebody else. What do you care? This is your life. This is not getting, a bikini wax. It ain't gonna grow back. You have to go with someone you really feel comfortable with. And everybody raved about this guy, so it's hard because you think, oh, but everybody loves them. Listen, some of you know my story about the dentist in Matawan with Hayden. Highly recommend it. Everybody loves this guy. I think he is a Nazi. I can't even believe what he did to my daughter. So even though everybody recommends somebody, yes, my sister says, I love my oncologist. He's knowledgeable and very important when you're going to this. Yeah, oncologists is kind of tough because they are the ones who kind of put your treatment plan together. But you have a lot of control too. Like I said, I denied the tamoxifen. So what they give you is a suggestion. There's no gun to your head. If you don't want to do it, you don't have to. I've had friends who didn't even do chemo when it was suggested to them. And they survived. So I don't know. Okay. I talked about a psychotherapist. I suggest one that does work with people who've gone through cancer specifically, because there's so many different areas that you talk to them about. It's you talk about your personal relationships. With mine, we talked about a lot of how I was going to address things with my daughter, because she's 3, she's turning 4 next month, and she's at that age where she kind of knows what's going on. And I think there's even children's books. I'm going to add that to one of my resources. There's some children's books that will, you can read along with your child and that sort of thing. Especially when you get a surgery like this, because small children, they want to climb on you. They want to, they want to tussle. Why can't mommy tussle with me? For me, especially going through my surgery, I was kind of hidden down in my basement for a while. So I was like, where's mommy? What's going on? They know. So the psychotherapist can really help you with that sort of thing and how to talk to them about it and address all that stuff. Okay, so the next one I have on here is, of course, occupational therapy and physical therapy. I am an occupational therapist. I love what I do, but I do feel very limited because everything we do is to insurance. I work in geriatrics, so everything I do, all my documentation, all my goals, everything I do with my patients has to be billable. Everything has to go to Medicare standards. So unfortunately, I've been having a hard time finding OTs and PTs that specialize with people who who've had mastectomies. Working on it. I consider myself someone, so if you know anybody going through this, absolutely they can come to me, and I will share my experience, my resources, anything I can, because you know, after I had my surgery, I asked my doctor, so what's next? Do I go for physical therapy? I don't know. Do you want to go for it? I was like, well, yeah, I have to get my range of motion back. I have to dress myself. I have to, you know, I started talking all occupational therapy to him, and he looked like he had no idea what I was talking about. You know, physical therapy and occupational therapy, sometimes we're like the bastard children of the healthcare field for some reason. I don't know why, because we're so important, and our job is to bring, oh, look at that. One of my stripes is falling. Ha! Get back up there. Fix that bad boy later. So anyway, ask your doctor, please. Advocate for occupational therapy and physical therapy. Sometimes people even need speech therapy, because when you're trached, you know, you have some problems with swallowing and things after that. So please, advocate for occupational therapy and physical therapy, because they're really important for these surgeries. Okay. I also added to the list for your team, obviously friends, family members. Don't feel like you can't ask. Please ask. Ask for everything. Can you go to the grocery store for me? Can you do this for me? Can you do that for me? People want to help. They really want to help, because as you know, you want to help and you want to do something for them. You don't know what to say. You don't have to, you know, that's a whole other discussion of how to talk to a cancer patient. But helping and doing something. The funny thing was, and I don't want to sound like I don't appreciate it, when I came home from my mastectomy, I had flowers everywhere. Everybody got me flowers, which was wonderful. But I sat there and thought, this could have been a lot of groceries. And some people gave me gift cards to like Peapod or ShopRite. Like, that was great, especially Peapod, getting the groceries delivered. Things like that, you know. So flowers, wonderful, absolutely. But things like, come babysit for me, you know, come cooking, you know, bring a tray of food, things like that, you know. That's a big help. Other survivors, always you want to talk to people who've gone through the same thing as you. I put hairstylists, manicurists, and estheticians, because first of all, they love working with people who are either getting treatment or, you know, actively getting treatment or after, because it makes them feel good to make you feel good. And it makes them feel good to make you feel pretty. One thing that I did during what I was going through was I bought some clip-in hair extensions, and I worked with my hairstylist so they would cover right here, and she loved it, and it made her feel good to be involved. It was like her treatment. She felt like she was treating a cancer patient. You know, that's what she can contribute. And she loved the idea of like, let's make your hair longer and thicker and, you know, cover your breasts as you're going through this, and you don't feel, you know, because I got it done in June. So it was, that's another thing. Try to get it done during the winter so you can wear nice thick sweaters. You know, you can cover everything up. But at that time, you know, I couldn't wear a turtleneck. So your beauticians are also a big part of that. Okay, so the next thing I want to talk about is assembling your space at home. So when you come home, you need to have everything set up. My friend Danielle, I don't know if you're on, Danielle, she had suggested these recliner chairs that, you know, you can rent from your local pharmacy, and they're powered to bring you up and to recline you back, okay? So again, this is where occupational and physical therapists, this is our thinking, because you can't use your upper body to push yourself up. So you have to really use your core muscles and your legs to stand up. But even your core muscles are very affected by it, because anytime you remove things, muscle, you remove anything from this area, everything that surrounds it spazzes out. So if you're removing any muscles or tissues or things like that, anything that's around your core is going to go, whoa, 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 what just happened? We don't know what's going on. It's going to take a while for it just to kind of settle. So even just using your core to pull yourself like that was difficult. I slept in a recliner chair downstairs, but still my husband would have to put his hands behind me and push me up. It was actually pretty funny. What I ended up doing was sleeping on a very flat couch that we have. And what I would do is, and this is funny, this is what I teach my patients, especially ones who have had back surgery, how to get up and back, is you lay down, you roll to your side, and then as you drop your legs, you bring yourself up to the side. It's sort of like a seesaw. So if anybody could see me, I look like a flopping fish out of the water trying to roll myself up. But it worked, and I knew how to do it. So anyway, the recliner chair, but my friend Danielle said that she slept in the recliner chair for like a full month. So she didn't even have to worry about getting up, okay? Because when you got to go to the bathroom, you got to go. So you buzz it, it lifts you up, and you're up and you're good. So again, you can rent them from your local pharmacies. The side table, you set up your side table, you have to have everything. You want your remote control, always have some water. You got to keep hydrated. You're going to be on pain meds. You got to keep everything flowing and going through you, okay? Because constipation is a big thing. Maybe prune juice, you know, all that good stuff. But keep yourself really hydrated. iPad, phone, set yourself up with your chargers, magazines, journals, pens, because you might think of questions as you're, you come home from the hospital and you want to think of all those follow-up questions for when you go see your doctor for the follow-up. I recommend cough drops, maybe some tea, because again, after you get trached, you're going to have a sore throat for a good couple of days. So have cough drops and things like that. Have it all there. As far as your meds, keep your meds handy too, because you don't want to wait to ask, oh, hey honey, can you get me some Percocets? Have them there. Again, be careful if you have any dogs or small children, but also remember to have them kind of opened already, because opening jars and opening bottles of meds, I still have a little bit of trouble. I was trying to open a peanut butter jar the other day, and it was really difficult. So keep those meds open, or I know some places like Target, they have the ones, they're kind of easy open. They have the little doohickey on the top. Those would be good. Or put them in another container, the ones that maybe just, you can fill the Sunday to Saturday and just flip it up. But just remember, opening a thing of meds is going to be hard. Opening a bottle of water, don't have it a cup with a straw. Okay, because that's another thing too. If you have a cup with a straw, you can just kind of lean over and suck it out. You don't have to worry about using your hands to do the cup, okay? So you'll see there'll be a lot of little tricks you got to think about, just, I hate to say think about your arms are cut off, but because you will be able to move your arms right at your elbows. It's more about your shoulders, okay? All right, I'm going to try to make this really quick. All right, adaptive equipment. Again, I'm an occupational therapist, so I love anything. A long-handled reacher. There's cuffs that you could put on your cup, or even if you have mugs, just rather than go like this to do your mug, just stick your hand through it, okay? It's easier on you're using a larger group of muscle and joints in your hand. I recommend an essential oil diffuser. I had one in my mother-in-law brought one for me in the hospital, and it was fantastic to have some lavender going in the room, everything. I'm telling you, I hate to say it, but it was a wonderful recovery for me, because I knew from the first time, I really had a great team in place, and it was a little vacation for me. Between a morphine drip and lavender essential oils, and cable TV, and it was fantastic. And again, for some of you who really do need that strength to get through this, put out some pictures of your friends or your family at the hospital, at your side table when you come home. Many of you are into vision boards. I have one here in my office. Make yourself a vision board maybe. And it could be very therapeutic to think about the new person you're going to be after this surgery. What are the new goals you're going to set for yourself? What are the things you're going to accomplish? Cancer can very much be a big wake-up call, you know, to not put things off. Liz, I'm going to talk about you again, but my sister just went to Italy, and she had been talking about going to Italy for a long time, but then now she got diagnosed, like, okay, no more waiting. Now I do it. Oh, there goes the stripe again. Back up there. My new pink stripes. Okay. Before you go on your surgery, make sure you have all your laundry done and folded. You might want to keep everything on top of your dresser, things that are easily accessible, so you don't have to pull any drawers and you don't have to go up reach up to the closets. Just on top of your dresser, have a stack of underwear, have your socks, have your this, have your that. You're going to want, of course, very loose drawstring pants that can go up and down very easily for when you go to the bathroom. Lots of pillows handy, okay? Get little pillows that you can put under your armpits. Will really, really help a lot. Pillows to elevate your arm. If you get a lot of lymph nodes removed, I had 5 removed. If you get a lot of lymph node removed, you really have to be cautious of lymphedema. So I actually asked for extra pillows when I was in the hospital, and I made a big mound of pillows. I slept with my hand up like this, and you want to pump your hand. There's my hand. Pump your hand. Make sure you keep that fluid going through, okay? If you do find that it's getting bad while you're in the hospital, ask them for a lymphedema glove, okay? It's just a tight glove. I asked for one. They had an OT actually come upstairs, and she took a look at me, and it wasn't that bad. So she was like, you really don't need one. Let me just read some of these comments here. The powered recliner, yeah, that was a good one. Yeah, Janice, we have to talk about yoga. Absolutely. So great to get your range of motion back. It's such a great way to do it. I'm still working on it. Okay, lots of pillows, laundry, even the countertops like in your kitchen. Okay, put everything right on the countertop. Your house might be a mess for a while, but you know what? Deal with it, okay? Lazy Susans are good, that sort of thing. Just anything you think you might need. Tea, any condiments, make sure you take them down, okay? Keep one pot, saucepan pot on the stove. Don't put it away, just keep it there. Okay, your pre-surgery shopping list. Definitely mild foods, because your stomach with all the meds and all that kind of stuff, it's just, you're not going to really be in the mood for, I actually was, but I had a quesadilla, I think, at the hospital. But most of the time you want things very mild. And I brought snacks to the hospital because hospital food is gross. And, you know, you can ask for a lot of extra things. Maybe just like a plain corn muffin or something like that, but sometimes it's just too greasy or anything like that. So, you know, make sure you buy everything ahead of time too. Yogurt, probiotics, that's a big one that they recommend. Fiber-rich foods, definitely fiber-rich foods. Again, constipation. We won't get into the details, but you want everything that's going to help things move and get all the meds out of you. Easy to prepare foods, okay? Unless somebody who's going to be staying with you, but, you know, if you are going to do any frozen foods, I definitely recommend any like Amy's Organics. Be careful with that kind of stuff. I don't want to get sued or anything, but I do contribute a lot of my first diagnosis to frozen foods, because there was a year while I was in graduate school that all I ate was lean cuisines. And now we know all the processed crap that's in them. I mean, literally, that is like all I ate, because I was so busy between working full-time and graduate school. So now if I do frozen foods, I really read the ingredients, because they put some nasty junk in there. I'm really big on Peapod. I think they were fantastic. I think ShopRite does delivery service now too. So again, I wrote here, ask people who send gift certificates instead of flowers. Unless you want some flowers, that's nice, you know, to have just for the smells and for the look and everything. But don't forget, if you don't have somebody changing that water and those flowers for you, because you're not going to be able to carry a thing of water and dump it and everything, that smells funky. Yeah, those flowers after a while really smell gross. So opt for an oil diffuser if you want good smells. Okay, so we talked about applying for disability and FMLA immediately. That's the first thing you want to do because it takes so long and the logistics of it all are just a mess. So get on that first. This way you don't have a big lull in your paycheck. Reach out to local breast cancer organizations. Like I said, I like Just Us Girls, Breast Intentions, the Beauty Foundation. Those three were really great to me. And of course, Mary's Place by the Sea. Anybody from Mary's Place? Hi, Mary's Place. You know, they're going to be having their big reopening this spring. They are a respite home you can stay there for the weekend or you can just go for the day, and they offer free services like Reiki and massage, even some psychotherapy and things like that. And it's a great place to connect with other women. And once you're all done with everything, it's also a great place for you to go and pay back, and you know, be there for the up and comers, the freshmen. So you know, I'm not against like American Cancer Society or Susan G. Komen or Cancer Cares or anything like that. I just find that because they're so big, sometimes it's hard to get to who you need to talk to. It's one of those where you call and there's 50 different prompts. But not only that, any time I've tried to apply for things, they've literally given me like this thick of an application. One of these, I applied for a grant and they wanted my past 3 years of taxes. I was like, okay, this is getting ridiculous. Okay, I'll put you in touch with my doctor. My doctor will send you any documentation you need. I showed them some bills. I made a budget for them, but it was too much. And it was like, listen, I got enough going on right now. This is too much. You're asking too much of me. I really wish they simplified the process for people. And that's why if your oncology social worker can help out, that's great. But I find that it's just a much easier process when you're working with local organizations. They don't ask for so much. Okay, surf the internet and message boards with caution. You know, I'm so 50-50 on that because I do want to know information. I guess you have to really be cautious about where you're looking. Make friends with the doctor's support staff. Like I said, that's a big one. Okay, what to pack for the hospital? Have your ID and some cash. I say about $40 of cash. Keep it in small bills because you can always get stuff from the vending machines. You know, if you just want like chips in the middle of the night, you can send one of the nurses to go grab you some chips. And maybe one credit card because you can always order out food if you're in the mood. I was really lucky. I was at Riverview and Good Karma is right there. Many of you guys know Good Karma, and they're the perfect food because you could order a juice, which is great because I just felt like my body just wanted nutrition. I could feel it, you know, so a juice just was like, it was fantastic. Clothes, elastic drawstring pants, things that are really easy to toilet with. Really, you got to make sure they're big. Warm clothes, because the hospital gets cold, so layers. And of course, everything you want zip front or button front. I go more for the zip front because you could always have a nurse help you do the latch, but doing the up and down buttons, you know, just might be a little bit more tedious. But make sure you bring some warm stuff. I say bring a blanket as well. I brought my own little blankets. It just also gave you a little sense of home, a little coziness, because in the hospitals, you know, it's just they're thin blankets. I mean, you could get 100 of them. They'll pile them on you. But then when you're trying to move yourself around, because bed mobility is really difficult. Again, you can't use your upper body, so you're not using the bed rails to roll yourself over. So you get kind of lost in this mesh of blankets. It gets crazy. So ask a family member to bring you one nice thick blanket. I had a nice thick fuzzy one, which I love. Bring food, snacks, and gum. Gum because you could just get a little yucky in the mouth and stuff. Cough drops and tea. Bring that to the hospital as well. I had Ziploc bags. I'm the queen of the Ziplocs. Bring some tea bags. The nurses will bring you hot water. and cough drops. Phone, electronics, headphones. Technically, what I have been told is that oncology patients are never supposed to have a roommate. You're always supposed to have a single room. I know at Riverview that is their policy. In fact, while I was there, their oncology unit was being renovated. So they brought me to another section, but they still made sure I had my own room. So ask for it, okay? Say, oh, I was told that you're supposed to have my own room, blah, 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 okay? Just say it. But I say headphones because just in case you don't, you know, you do, if you want to listen to the TV or listen to your iPad, iPod, whatever, you have that privacy. Okay, and make sure you have your chargers. That's always a big one, your chargers. Essential oils and diffuser. Okay, this is my #1 tip. Electric toothbrush. You have to have an electric toothbrush because you are not going to be able to do this. And everybody who stayed in the hospital knows you want to brush your teeth, you feel yucky. So an electronic toothbrush, because you can hold it like this and you can work it with your mouth and your head like that to brush your teeth, okay? Then you get a cup and you can rinse and spit, all right? Electric toothbrush, definitely, okay? I'm big on a sonic here. I'm not big on the ones that just swirl, swirl. I need like the power. Bring your own toothpaste and your own mouthwash. I like to do that. Small soft blankets, small pillows for under your armpit. Danielle gave me those. I don't know if you're on, Danielle, but thank you. She had given me the small little pillows that I'm holding on to pass on to someone else. That's kind of like our sisterhood of the traveling pants, sisterhood of the little armpit pillows. Long handle reacher, a sock aid. Again, you do have staff there who will help you put your socks on and off, but there are the sock aid where you put the sock on and it's like pushing your foot through bootstraps that goes right on. Baby wipes. Bring baby wipes. You can give yourself a full body bath with them. I love Burt Bees cucumber wipes because they're so refreshing and you feel so gross. Dry shampoo too. You can bring dry shampoo. I didn't, but people, especially if you have short hair, it starts to get kind of funky. So the cucumber wipes, washing my face, I mean, everything, wash your ears, it feels just so much better. Okay, so baby wipes. For many of you, bring prayer book, rosary. I brought my little Bible, journal, pen, makeup, glasses, contacts, and solution. Contact solution, everyone always forgets that. And again, if you want to email me directly at healthyjerseygirl@gmail.com, I can send you a list and we'll make a little check-off list for you. And again, a lot of this, it's not only for mastectomy, this can be for a lot of things. It's funny when I talk to women about this, we equate it a lot to pregnancy. A lot of the preparation and even the preparation for coming home is so much like when you were pregnant. But the difference is you don't have 9 months to do it. You got to do it like, for me, it was like 2 weeks I had to get ready. So it's kind of funny, the correlation between the two. You can always ask friends in lieu of flowers to bring you anything you have forgotten to the hospital. Maybe a little care kit with the wipes. Yes, that's great. Yeah, tell your friends. I forgot this. I forgot this. I forgot that. I bring also my own little thing of tissues. Even though they have lots of tissues, theirs are like sandpaper. So if you really like the good ones with the aloe, that's always a good one to bring. Okay. I have a lot of information here that's a little clinical, and I know a lot of you guys are here more to not so much for the clinical side. So I'll have maybe a follow-up talk where I talk more about the clinical stuff, but I'll just get into a little bit, especially talking about lymphedema management, things like that, other complications that can happen. But right now, just talk about how, in the hospital, how will you feel afterwards? And again, this is coming mostly from my experience. I was incredibly fortunate to have a phenomenal anesthesiologist. You know, I'm not big with nausea, so he made sure that I had lots of Zofran. He just gave me a really good cocktail that I came out. I just felt a little loopy, but I felt good. I was like, yeah, this is awesome. I didn't feel nauseous at all. I really just felt great. So talk to your anesthesiologist before the surgery. You should be able to talk. I've had the luxury of talking to my anesthesiologists the night before they call me. I don't know if that's just a Riverview thing, but even right before you go into surgery, you should be able to talk to them. And I tell everyone, tell them, I don't want to be nauseous. Do everything you can to not make me nauseous, and it will make a big difference. Okay. I felt a little giddy. I also felt really relieved that was over. I just felt that sense of accomplishment, like, yeah, we did it. So even though I didn't do anything, I just laid there. They did all the work, but I just came out and I was like, oh, it's done, it's over, you know? Even though the recovery is tough, but you just that waking up, because that's where you have all the fear. You have all the fear of the surgery itself. Your anxiety and your fear is not about the recovery so much. It's all about that surgery, because you're, oh, what if something happens while I'm under, and the complications and this and that. So when you come out of it, you know, really relish in that sense of relief and that sense of accomplishment. You know, that was the first big hurdle that you got over. Some people might feel a little freaked out. You know, most likely not, because you're still very medicated, but sometimes people come out and they're really freaked out, like, oh my God, where am I? What happened? You know, that sort of thing. So again, those are things to talk about with your anesthesiologist. Say, please make sure that I am chilled out. Please make sure, and they will. I don't even know why people have to ask for that anymore, but the day I had my mastectomy, I know another woman who had hers, and she came out of her, she didn't even get to talk to her anesthesiologist. She came out of her surgery feeling nauseous, horrible. I don't understand why. Why at this point? There's been so much advancements in anesthesiology. Why anyone would even feel yucky afterwards, I don't know, but she did. You're going to feel really sore, like you did 1,000 push-ups. This whole chest area is just going to feel horrible and sore. And the thing that you might get freaked out at is that you can't move your arms. But that's temporary. Remember, it's temporary. Don't freak out. But that first time you go, oh, what the hell? Oh my God, I can't move my arms. I can't move my arms. It's the freakiest feeling. It's kind of the same thing. Any of you have ever had like a spinal block and you're paralyzed from the waist down, and it's really freaky that you can't move your legs? It's kind of that same thing. You feel you're paralyzed in your arms, but it's temporary. It is absolutely temporary. So you're going to be so packed up. You know, I wasn't even concerned at that point about like what was going on here and what it was going to look like, because you're so packed up with gauze and everything, and you've got a sports bra on. So it looks like you still have breasts because you're so packed up. So it didn't freak me out too much, but that's how you're going to look. You're going to look so packed up with stuff that it might not actually freak you out at first, because when you look down, you'll still see something raised. You're going to have drains. Ugh, I don't even want to put you guys through drains right now. You're going to have drains clipped to the side of your bra. Drains are very important, obviously, because your body just went through a lot of trauma. Your body got cut into. There's trauma to those tissues. So the inflammatory process of your body has just gone, all this fluid is gone to where you've been cut. That's how the body works. Unfortunately, if you don't have drains, you will blow up. So those drains are really important. So they're just little plastic bulbs that they're squeezed down, so they will open up and create suction to pull that fluid out of you. You probably wear them for about 2 weeks. In my case, because I had a lat flap, I had 3 drains. One was in the back where the incision was made, where they took the part of my latissimus dorsi. That one I had in for a month. That sucked. It got itchy and red in the spot. I mean, it's a hole. It's literally a hole inside of you. So drains stink. While you're in the hospital, the nurses will drain them for you, but you are going to have to learn to do them yourself, because they won't be removed until they're draining about 20 milliliters or less a day. That's something, you know, if you are going to get an aide or somebody at home to help you. I know my mother helped me when I had my lumpectomy. My mother helped me with those because I was a little grossed out by them. But, okay, let me just look at the messages here. Okay. So anyway, all right. So, you know, you're going to feel like your body has been mutilated. And, you know, for some of you, I would say don't look. Take the time not to look for a while. I had already gone through a lumpectomy, so I was kind of okay with it. You know, and again, I'm one of those who Google, so I looked at pictures of women post-mastectomy, so I knew what it was supposed to look like. And being a clinical person, I also sort of had that mindset of being clinical. Okay, let's see what this looks like. All right, let me check out my scars. So, but for some of you who are really going to have a hard time dealing with it, nobody's saying you have to look at it right away. You don't. Again, you're so packed up. You don't have to look at it. If your nurse comes in and is changing all your packing, just look away. Just tell her, I don't want to see it. And they will completely respect any of that. So don't look. If you don't want to look, don't look. You might look a little pale and beat up. And that's just because your body went through a lot. So, you know, don't worry. Everybody looks like that. You're going to just be beat up, but you'll be fine. Everybody you know, you come back from it. They do these surgeries so often now that they know what they're doing. They know what they're doing. Trust the professionals, as me and my sister like to tell people. Trust the professionals. They know what they're doing. Okay, so you have your drains. You might have a catheter, which I did, which is normal, of course. You know, you can't get up and pee, and you weren't getting up and peeing in the middle of your surgery. It's a little uncomfortable, and it might be a little weird. You know, just say to the nurse, say, you know, can I get this out? And they will, and just kind of bug them about it. I want to get this out. I want to get this out. Because sometimes I don't know, I feel like sometimes they forget it's in there. They might think, you can keep it. If you're like, listen, I don't feel like getting up and peeing. I just want to lay here, and I want to be lazy about it. That's fine. Just lay there and let your catheter do its work. I wanted it out. It was uncomfortable because, you know, I'm trying to roll around, and as you move, you feel it. So if you don't want it in you, just tell the nurses, please, because they have to get an order from the doctor. They can't just take it out. Okay. So remember that too. A lot of people don't know, you know, you ask your nurses for things sometimes and you think, oh, this bitch, she's not doing nothing for me. She's not getting me anything. A lot of times they have to get an order from the doctor first, which means they have to get them on the phone. It's a whole to-do. You know, things don't happen so easily like that, and people don't know that. Okay. I have people who will ask me for ice sometimes. Oh, can I get some ice on me? I'm like, I have to get a doctor's order for that. You know, I can't just throw things on you. So that's that. All right, moving. Shoulder movements are going to be really difficult. So, you know, don't be freaked out and ask for help. Just, hit that call button. You should be able to move at your elbows though. So you should be able to feed yourself. Okay. Use cups with a straw, but you should be able to feed yourself. I don't see where that would be any issue. If you have a hard time with utensils, just ask for finger foods. Okay. Ask them for finger foods. Ask them to cut it up for you. Just have some French fries or chips or something like that. Dressing is going to be very difficult, and you're going to feel like a baby. Like, I can't believe somebody's dressing me. But again, just remember, it's temporary, and everybody goes through this, okay? So have the nurse help you, bringing your arms through. Don't try to do it yourself. Don't be a hero. I know we all want to be tough and we want to be strong, but there are certain times it's not worth it because you could hurt yourself, you could rip something, okay? Toileting is a big one. I wrote here, call for help to sit up, just even to sit up, okay? Because that's going to be really difficult. So if you have to have that nurse come behind you and push you up, again, you have a hospital bed too, you can bring the head of the bed up. But your balance is going to be off because you're woozy, you've been on meds, you're weak from everything you've gone through. So you're not going to be the same. So when you think, oh, I can sit up, not right now. You're not who you were 24 hours ago. And it's not worth it because if you fall, then you have a whole other set of problems right there. And they're going to send you back down to where you came from. Okay, so it's not worth it. If you have to get up and go to the bathroom, please have somebody with you. Okay. All right, so when you get home and everything like that, you know, don't attempt to reach over 90 degrees, okay? You want to keep everything just down low, all right? You could put, if you have to wash your hair, bend forward to wash your hair, okay? Bend forward to wash your face, everything like that, okay? Don't try to do this. You probably won't be able to anyway, but don't push it. You really need some time for things to heal. Everything's going to tighten up, and there's going to be so much scar tissue, and you're going to want to break free from it, but give it a little time first, okay? You can start massaging the areas, all right, and just loosening up the skin and things like that. It's also going to feel strange because you probably lost a lot of feeling. I'm touching under my armpit right now, and it's numb. I don't really feel anything because it's scar tissue, and it's just, or scar tissue can also be hypersensitive. So don't get freaked out by that. A lot of that actually will settle, and things will, as you move more, things will break free. It will happen, okay? No pulling, no pushing. That's a tough one. So you want to push yourself up in bed. No, you can't. You want to pull something, pull a door open, things like that. I wonder if there's a camera in front of my daughter's daycare, and I still do this thing where I kind of hook my elbow on the front door, and then I use my foot and I like kick it. And they must be like, what the frick is she doing? But I do. Anytime I can use my feet to kick a door open and do things like that, I do. So listen, do what you got to do. Don't care what anybody thinks. And it's funny, you will learn not to give a crap what people think with a lot of things. No weight bearing. So if you do go back to yoga, no planks. You shouldn't really be doing downward dog. Definitely not a chaturanga. Nothing like that, okay? That is going to take a long time. I'm still having a hard time with weight bearing, and you have to be careful with that stuff, especially if you had a lat flap, because you're engaging a lot of your back muscles too, okay? Don't walk around with socks on. Either have shoes. I hate open back slippers. Ugh, please. And old people love to wear them. Slippers with backs, please. Just wear the socks with the rubbery things on them, okay? The hospital will give you all that you want. I have a ton of them too. Don't overexert yourself. You'll put yourself in increased fall risk. Okay, I'm going to skip over. It's already 8 o'clock, so I'm going to skip over a lot of the clinical stuff because I think most of you guys are here to hear the other stuff. Okay, so additional recommendations. You want to avoid repetitive activity because that's where lymphedema can come. So anything sweeping. I know a woman who got lymphedema 2 years after her surgery because she was shoveling snow, because it's a repetitive. Anything that's repetitive like that, aggressive cleaning, anything that's repetitive, okay? Get in the habit of driving with the opposite arm of the one that you had the lymph nodes removed. If you had it on both, just try to alternate, okay? Give one a rest, alternate. Where are my OT friends out there? You guys have any OT tips? Diana, you out there? Wear your purse or your tote bag on the other side. They have a lot of those rotating air blower things for your hair. Those are good. And it's so ironic because, and my sister will laugh when I say this one, our hairdresser just went through this. And a month later, she is back on the floor doing hair. And I'm watching her as she's doing this all day. I'm like, oh, what is she doing? Why did anybody tell her she can't do that? But again, she has her own business. She had to get back to work, and we all want to be a hero. You know, how many of you I know tell me, slow down, you're going to hurt yourself. And I do hurt myself. But you want to try to muster through it. And it's hard to find that balance. Okay. Avoid dependent positions, anything with your arm hanging, holding bags from the grocery store, your purse, things like that. Okay, I'm going to skip over all this stuff. I'll have to do a follow-up. So, all right, I'm just going to go right to my final thoughts here, and then I'll do a quick Q&A. So I have a section here I call, you know, our bodies are not who we are. So, you know, if you already were dealing with body image issues, this is just going to take all of that to a whole new level. You know, again, consult with your therapist. you know, if you are with somebody and they've lost interest with you because of all of this, you have to remember that that's not your problem. That's their problem. You know, that's their shit that they're going through, you know, and hopefully they will seek help as well. But if you are in a situation where that person leaves you, you know, to me, that is the ultimate litmus test. You know, you couldn't stick around for this. You couldn't make it through this storm. Maybe it's better that you found out now, especially if this is somebody that you haven't had children with, because if they can't go through this with you, they're going to go through, you know, pregnancy and childbirth and those first 3 months of having a baby, which are horrible. Nobody talks about. So sometimes I say, see this as an opportunity to kind of weed out, you know, weed out the weak links. There might be some people that you had hanging around that you never really had the push to kind of, you know, defriend them, so to speak. And it can be in a personal relationship, an intimate relationship, or it can be just friends. You're going to see who steps up and who doesn't. It's going to happen. So, you know, take this as a good opportunity for all of that to happen. You know, you want to, you know, this is a time to really regroup and think about things in your life and start new personal goals for yourself. Being an occupational therapist, I'm so big on, you know, the short-term goals and the long-term goals. And, you know, you have so much time on your hands in the recovery process. And that's why I say keep a journal and a pen, because you want to start writing things down that you're thinking about. Maybe some, again, things that you've never done before that you put off that you're going to do. I know that this was my year that's why I put on my website, this is the year to take yourself out of your comfort zone. Because I know myself, I live in my comfort zone, and I'm trying to do things to take myself out of that. Especially going through all last year was just a bust. You know, I was recovering all last year. Nothing happened. Yes, step into your power, Vanessa. So take this as an opportunity. For some people, it is that wake-up call. Like I said, for things that my sister wanted to do, this was her wake-up call. Like, no, don't wait till X, Y, and Z. You do it now. I'm telling you that you're going to do it now. Don't put it off. And I know I put a lot of things off. I really do, especially now that I have a child. That's a big excuse for me. I'll do it when Hayden gets older. I'll do this when, you know, we save enough money for this, or the kitchen renovation is done, and things like that. Couple other things. Ask your plastic surgeon for discounts for other services. My plastic surgeon, he works with an esthetician. Yes, next year Hawaii, Liz. He has an esthetician in-house, and they give all their cancer girls a free facial and skin peel. So ask and see if they do other things. Some of them will give you a discount on other services that the plastic surgeon provides. So that's great. Take advantage of it. You play the cancer card. Don't have no shame in playing the cancer card when you can, okay? You know, and taking an opportunity to try new ways to move your body. I'll say it again, if you never did yoga, this might be a good time to start with the yoga. And you start really slow. You start with restorative classes. You talk to your teacher beforehand. They love to work with people who've got injuries and things like that, because they learn and it makes them better yoga teachers. Try things like salsa dancing, belly dancing, water aerobics, maybe things that use more of your lower body. I'm looking into a couple of kickboxing classes now, because I can't do CrossFit, Max, all that stuff. I know they say, oh, you can modify, you modify. I'm like, yeah, but too much of it is things on your, you know, planking and this and that. And I don't want to be getting half of the class. So I'm looking into things. That's why I did the ice skating too. Something that uses more of my lower body. So ice skating, rollerblading, okay? try these new things now. This is the time to do it, because you want to get back into exercise, but you're not able to do a lot of the upper body stuff. But don't let that hold you back from getting back into shape. If you're having reconstruction performed, focus on your new body. Be excited that you're going to get new boobs. How great is that? I work in a nursing home and I get to see, you know, flapjacks all day. And I get so happy when I'm like, oh my God, I'm never going to have to deal with that. I'm never going to, literally, I'm an occupational therapist, so I'm doing ADLs every morning with my patients, and I'm dressing them. And I mean, some of them wear bras, some of them have completely given up, and yes, they are down to their belly buttons. The worst part is I toilet them a lot, where they're holding on to the bar and I'm pulling their pants up. And I'm not kidding you, it happens daily. I pull the pants up and their boobs are in their pants. Yes, they are. And hey, mine are to the sky. These suckers are not moving. So focus on that. You got to focus on that. This is something good that's coming out of it. All right, bye, Vanessa. I'll see you, hon. Okay. So, all right, so just in closing, you know, I have so much more here, and this is why I really love to do like a 3-hour seminar with people, but I'm just going to say a couple of final thoughts, and while I do, if you have any questions, please send me some messages here. Just shoot me any questions you might have, and if we don't have time here, I can email you personally. But a couple of final thoughts I write: trust your clinicians. You know, you're not the first to have this procedure done, and you won't be the last. But again, if you don't feel that if you don't feel comfortable with them, or they're just, you know, there's just not the right vibe, or they just say something that you're like, I'm not really sure about that. Really, don't feel bad about looking into somebody else. Don't. And you've got so many people, me included, to ask. Do you know anybody here? Do you know anyone here? Can, you know, ask around. There are plenty of us cancer people around. Mantras and affirmations. The night before my surgery, I took Post-it notes and I wrote little affirmations on it. I just wrote things like, be brave. You know, you can handle this. It'll, you know, all you have to do is lay there. You know, I just wrote all these little affirmations. Again, like, you're not the first, you won't be the last. They do these every day. And I posted them on the wall out in the hallway. I'm sure my husband went out to the bathroom in the middle of the night and was like, what the heck is this? But I just kind of put them all over the place. It was like my way of coaching myself for that last 24 hours. Because that's when the anxiety started. I was kind of good all week, but it was like, as it got closer and closer, that's when you know, it's coming, it's coming. You mentioned that you hated the slippers with the open back. Is it a safety issue? Yeah, it's absolutely a safety issue, because they slip right out. People who don't have good balance, you know, they're not secure on their feet. And I have so many patients who, they love their old slippers without the backs. And they slip out of them all the time. It's just not safe. It's just so much more secure to have a back on them. I'll take a picture of somebody's and I'll show you. Use the internet with a grain of salt. Continue to utilize your team. Your team is number one. Get your team together. So important. Think about your next move. How are you going to grow from this experience? Think about maybe how you're going to pay it forward when you're done. That was some of the things I thought about. I was like, okay, I'm going through this. How is this going to make me a better occupational therapist when I go back to work? You know, I'm able to say to a lot of my patients, yeah, I know. I actually do know how that feels. Yeah, I have been there, you know. So think about how you're going to take this experience and you're going to turn that lemons into lemonade, because there's so many opportunities to do that. And one of them, like I said, is to get involved in some place like Mary's Place, where all you have to do is show up. They have lunch every day. They have dinners, you know, just show up to the house, or we'll call them maybe and get in contact with Maria first, let her know that you're coming. But once you've made a relationship with them, you can kind of drop by and just come and talk to the ladies, and you've given something back right there. Going to charity events, obviously going and doing the 5K runs and things like that. But I think it's more personal if you do something with a local organization and do something directly with the patients. I'm not against these 5K runs, but they are just getting so commercialized. I think that they've lost a lot of their personal, their personal contact. So things at the hospital, just donating things to the hospital. I have a couple of drain bras. They make drain bras. If you want to email me, I'll tell you about that. I have 2 of them. What am I going to do with them? So, I want to donate them to someone. So there, that made me feel better. I have somewhere to donate them to. So something like that. So, okay. Anybody have any questions? Oh, thank you, honey. Thanks, Liz. I really had so much more information, but I really rather, spread the word. I like to be doing these presentations in person, where I could have more time. We could take a break. I could bring a juicer. We could do some juicing and have some little mocktails. But I'd like to do this where I can get into more of the clinical details and things like that to help out people. But please spread the word. I'm going to try to do it at the Bella Vista Social Country Club. I'll hook up with Anthony, and at Mary's Place, places like that. So that's it. Anybody else have any questions? Think we're good? All right. So guys, I'm going to have this as a replay on my website if you know anybody who'd like to watch it, and just stay in touch for any follow-up. Thank you, Mindy. Any follow-ups I will be doing as well. I'd like to start extending this into more specific areas, working with some of my friends who are therapists, like my girlfriend Day, who is a sex therapist. We might do one that's just specifically on cancer and sexuality, things like that, or maybe on cancer and dealing with children. So I will be doing some more specialized talks and things like that, okay? So keep in touch. Thank you, guys. Love you. See ya.